In stroke, time is an essence because I'm Dr. Adolfo Herminal Jr. I am an IM neurologist. A stroke is called a brain attack. So it's a sudden onset of focal or global deficit or neurologic deficit involving an underlying vascular pathology. So there are two types of stroke. So you have the ischemic type and the hemorrhagic type. When you say ischemic stroke, there's an infarction of the central nervous system. So it means there's a blockage. When you say hemorrhagic stroke, there's a rupture of vessel or abnormal vascular structure directly into or around the brain. It means there's bleeding inside the brain. The most common risk factors are mostly metabolic, so hypertension, diabetes, obesity, excessive alcoholic consumption, sedentary lifestyle, smoking. There are others that has underlying pathology in their coagulations, arrhythmias, or underlying problems in their heart. In stroke, time is an essence because if you can identify, you can bring your patient or patient can be brought to the hospital at the earliest time, then there are medications that can be given which can sometimes reverse the symptoms of stroke.
What are the earliest warning signs which people watch for when it comes to stroke?
In stroke, there's a mnemonics. The present guideline right now is be fast, balance. The E is the eyes, so it could be blurring of vision or doubling of vision. The F is the face, so facial asymmetry on one side. A is weakness or numbness of the arm and leg on one side. S is speech, slurring of speech. And the T is that onset of symptoms. The doctor's hospital right now is embarking on a mission that the hospital will be a stroke-ready hospital. We're doing certification from the SSP or the Stroke Society of the Philippines that this hospital would be part of the many hospitals in the country that is stroke certified. It means that the hospital is equipped in handling patients with acute stroke, especially in acute ischemic stroke, wherein you can give a medicine, it's called a thrombolysis, that can reverse the symptoms if the patient is brought to the hospital at the earliest time, especially if the stroke symptoms is within 3 hours. And also, the hospital is investing on high-end equipment like the MRI and the high-resolution CT scan that can be used in fast diagnosis of patients with stroke. So right now, we already have a MRI stroke protocol, which is a very quick MRI procedure that can identify the type of stroke within the 15-minute period from the onset. The essentials diagnostic tools are already available. High-resolution CT and MRI, to the echo, we have carotid. In the future direction, a cath lab would be a project maybe in the future. So these are usually used for interventional because right now, stroke management is geared towards interventional neurology, stents, the retrieval of clots. Also, doing it leap and bounds. A cath lab would be a very good investment for the hospital. The hospital is embarking a stroke-ready hospital and hopefully a stroke unit in the future. Patients are really guaranteed that they will be managed by experts and trained professionals with regards to stroke disease here in Doctor's Hospital.